Is an MRI scan necessary to diagnose osteoarthritis? Imagine feeling joint pain that just won't go away and wondering what's really going on inside your body. When it comes to diagnosing osteoarthritis, many ask if an MRI scan is needed. The answer might surprise you. Most of the time, an MRI scan is not required to diagnose osteoarthritis. Doctors usually relying on your medical history and a physical exam to start. They look for common signs like joint stiffness, swelling, and limited movement. X-ray images are the main tool used because they can show typical features of osteoarthritis clearly. These features include narrowing of the space between bones, bone spurs called osteophytes, and changes in the bone structure. X-rays are quick, affordable, and widely available, making them the first step in diagnosis. An MRI scan can be helpful, but only in specific situations. It is more sensitive than X-rays and can detect early cartilage wear, soft tissue inflammation, and bone marrow changes that X-rays might miss. If your symptoms are severe but X-ray results show only mild osteoarthritis, an MRI can help clarify what's happening inside your joint. It's also useful when planning surgery, like a knee replacement, or when doctors need to tell apart osteoarthritis from other types of arthritis, such as rheumatoid arthritis. However, in most cases, if your symptoms are typical and X-ray findings are clear, an MRI is not necessary. It can be more costly and takes longer to perform. An MRI can cost several $100s and usually takes about 30 to 60 minutes. It is usually ordered by specialists in secondary care, not in primary care settings, unless more detailed information is needed. In summary, an MRI scan is a helpful tool for detecting early joint changes or complex cases, but it is not a routine part of diagnosing osteoarthritis. Doctors mainly depend on patient history, physical exams, and X-ray images to make the diagnosis. When symptoms are unusual or unclear, or when planning treatment, an MRI can provide extra details to guide the best approach.